Hello, I'm Thurston County Commissioner Cathy Wolfe, and you're watching Thurston County Connection on TCTV. Today's program, we're going to focus on the criminal justice system, and particularly some of the things that we're trying to improve here in Thurston County, some of our local criminal justice reforms. But first, let's talk about the problem. The United States, as you probably well know, incarcerates more people than any other country in the world. And here in Washington State, we incarcerate more people for low-level, nonviolent property crimes than any other state in the nation. Here in Thurston County, we also spend 77% of our general fund, which is our discretionary money, a budget, on the criminal justice system. And of the people in the system, we know that 45% of them have diagnosed mental health problems. And if you talk to any law enforcement officer across the United States, across the state of Washington, across the county, they will anecdotally tell you that easily 75 to 80% of the people that are in our jails are there because of drug and alcohol issues. And sometimes these are the actual cause for why they're in our jail. We also know that the benefits of incarceration really occur in the first couple of days that you're in the jail. When that door clunks behind you, that's the real realization that I am locked up. And this is the aha moment that really turns people around. Beyond that, when you keep them in longer for these low-level offenses, you're just simply teaching them to be better criminals. In addition, there's the collateral damage to the families. When you are in the prison and jail, very likely you're either unemployed or have a very low-level, low-paying job. And we all know that you can't be gone from low-level jobs very long without getting fired. When you do get fired and you can't work, you can't support your family. It's very likely your children may end up in foster care or in the social service system. And all in all, research shows that children whose parents are incarcerated are much more likely to end up in the criminal justice system themselves. In addition to the impact on families, this system also costs taxpayers $114 a day, or about $40,000 a year. This is not working. We are not making people safer. In fact, we're making them less safe in the system we're using now. And what we're proposing is not to go soft on crime, but to be smart on crime. We hope that you'll continue to watch this show and see some of the things that we're proposing in Thurston County to reform this system and to mitigate some of these effects. Hello, Cathy Wolfe, Thurston County Commissioner again. And today we're here in the Triage Center, a facility that you're going to be hearing a lot more about in a few minutes. And I'm here with Mark Friedman, our Social Services Division Director, and Joe Avalos, who is our Social Services Division Manager. And I'd like to start with you, Joe, to talk a little bit about mental health and drug addiction or substance abuse. What is the relationship between those two, and why is it important to treat them together?
Well, we've known for some time now through research and through practice that people with a mental health or a mental illness are more likely to suffer from addiction than somebody without a mental illness. And so just here over the past several years in Thurston County, we know that over half of the people that we see in publicly funded drug and alcohol treatment also have a co-occurring mental health issue. And all the research and all the practice shows that it's much more effective to have integrated models where you're treating both the mental health issue and the addiction in order to have better outcomes and for the person to recover in a much better way.
Now, is that something we're doing just here in Thurston County, or this is a statewide initiative, is it not?
This is statewide. This is actually nationwide, where we're beginning to understand the relationship between mental health and addiction and how one exacerbates the other. So there are many programs that have been established for some time and some budding programs that look at integrating the treatment for both. It is newer here. It's newer here in this state, and that's thanks in part thanks to new legislation that just passed in 2013 that integrated the funding for both mental health and substance use disorder treatment. And so what that means is that we're able to break down some of the silos that have existed for a long time, where somebody had to go to one agency for mental health treatment and another agency to get help with drug and alcohol issues. That makes it very hard on people if they have to go to two different providers. Now, with the funding silos broken down, we here in Thurston County and actually all over the state are able to focus on integrating models and having agencies that are able to do both mental health and addiction treatment, and hopefully have better outcomes again for clients in our county.
Well, I know this is something we've been trying to do here in Washington State for many years, actually, back when I was in the legislature, particularly combining the funding, or at least melding the funding so you can deal with both. But I understand that by 2021, we're going to be adding also physical health, so you'll really be looking at the whole person.
That's a very great point. The first step is integrating mental health and substance use treatment. And in 2020, we will be looking at how physical health plays a part, because we know that that's a big issue as well. Co-occurring disorders with mental health and substance use is just one part. But people with mental illness and with substance use disorders also suffer from other physical issues as well, diabetes or abdominal issues that come as a result of addiction or mental illness as well.
And even if they're not as a result of, I would still imagine they have to treat the physical disability or issue. And running from one place to the other is not the most effective way to do it. I think a holistic look certainly makes sense.
That's exactly right.
Okay, thank you, Joe. Mark, tell us about this facility we're in. As you can see, we're still under construction. This is a triage facility. Tell us how it's going to be used, why we have it, and how soon it'll be operational.
Thank you. The triage facility is, in terms of licensing, it's an involuntary facility. It's one where we're able to treat people who are a danger to themselves or others, people who have acute episodes at the moment where they really need care right at that spot, right at that time. The design of this facility is, first we have 10 beds capacity, and we see it operating starting September 1st. The purpose of the building, or really the facility and the program we're going to be operating here is, the primary purpose is for diversion. Jail diversion in particular, and hospital or emergency room diversion. Too many individuals who are first encountered by police or any first responder, the choice is, because of lack of resources, end up in jail or taken to the emergency department here. What we're trying to do is provide an alternative or an option for police to utilize, where if the individual's primary issue is around their behavioral health disorder, is to bring them here where we can treat them. If the individual's willing to, voluntarily hasn't committed a crime, but is still being engaged by the police, we will have other options that we're building now, sort of a large bundle increase in our level of services. And the other services would be a mobile outreach team to engage with police at the time they're with the client, so we can start working with them right then and there. So if somebody's, say police go to a shelter and there's an issue due to somebody's mental illness, we can start right then and there. But this facility gives police an option to bring them here where we can ensure treatment will be happening for those people who are the highest risk in the community, but it's due to their behavioral health. If there's a safety issue, we still have the jail. If it's really due to criminal behavior, we still have the jail, but we now have this additional resource to use for the community. So the impact, what we're hoping for is, again, how do we reduce how many people with mental illness or substance use disorders are ending up in inappropriate care or just on the street. Now we have an alternative.
And how long can people be here before I'm assuming this is a stopover where you try to find more effective treatment. This is not intended to be a permanent facility?
No, that is correct. This is because it's an involuntary facility, typically a stay will be 3 days. We'll reevaluate them to see how stabilized they are at that point. But the average length of stay, say, is going to be about 5 to 7 days. The intent here is to stabilize and then move them out back into the community, but with treatment, with ongoing services. The hardest piece that we have, though, in terms of providing this ongoing care is it's very hard to treat somebody if there's not a roof over their heads. And so we're struggling to make sure we have the sort of what's called the bricks and mortars, where we have actual money for rent or for housing for an individual. We have the care, we have the treatment, we can support them in housing, but for us, we can engage them, we can provide initial treatment. The question is then what happens afterwards? We can keep treating the person, but we need to also make sure that there's a roof over their heads, that there's food, that they're sustained in the community. So that's our absolute outcome, is to bring people up to their highest level of functioning. You know, it's a recovery model where we want people to really engage, be back in the community, be doing what they want to, but in a safe, healthy, and an opportunity for them to grow and become part of the community again.
Very wonderful, absolutely fantastic. This is something we've needed for many years, and it's going to not only save taxpayers a lot of money, it's going to put lives back together, it's going to help families. It's just the right way to do things, and I'm so happy that we're finally getting close to doing this. So September 1st.
September 1st, and thank you for your support, for allowing this building to happen, and now we're able to create this or these additional resources in Thurston and Mason County. It's necessary, and we couldn't have done it without you and the commissioners' support. So thank you on this.
Well, Mark, if this is different than a jail, can you say a word about what's different when people walk in the door? How did they get treated differently here than they would be at a jail?
So that's a great question, because we really do want to point out the intent of this facility is to provide treatment services. The staff here will be clinical staff. We'll have nurses, doctors, even some medical services here in case an individual needs, well, to go beyond even an evaluation if they come in with some kind of pre-existing condition. But the idea here for us is to engage an individual in treatment. This is not a jail. This is not just security. This is where we have a recovery model where we're really trying to assist the person in stabilizing, in moving at get to the highest level of functioning, where they're able to work on their issues, start new medication if necessary, be able to set up the referrals necessary for them in the community. So this really is a treatment facility. From the first moment somebody is dropped off here, walks in the door, they will be engaged by a licensed individual, and it's going to be a licensed agency, licensed mental health agency that will be operating this facility. So the care, it is all about care here.
Okay, thank you very much. This has been very helpful. Again, I hope you'll continue to watch, because in the next segment we're going to talk about how people actually get here to the triage and how this system works in terms of some of the reforms we're trying to make here in Thurston County. Once again, I want to thank my guests here, Mark Friedman, the Director of the Division of Social Services, and Joe Avalos, the Program Manager for the Division of Social Services. Thank you very much.
Thank you.
Thank you.
Hello, I'm Thurston County Commissioner Cathy Wolfe, and you're watching Thurston County Connection on TCTV. This program is on innovative justice, some of our new criminal justice programs we call innovative justice. And in this particular piece, we're going to be talking about the triage center and trying to drill down on some of the programs and exactly what they provide. Or at least as close as we can. This is a work in progress, as close as we know at this time what we plan for these programs. And with me today is Daryl Rodriguez, our what I call public defender. Technically, he is the director of our Office of Assigned Counsel. And to my right is John Thunheimer, Thurston County prosecuting attorney. So, what I'd like to do today is talk about, first of all, an estimate of just how many people we think we're talking about that are in the jail with mental illness issues or drug and alcohol issues that are probably a large part of the reason why they're in the jail. And then I'd like to talk a little bit about some of the specific things we're doing, specifically the triage center first, and then the LEAD program, which is Law Enforcement Assisted Diversion, as you well know, the Crisis Mobile Team, and then the Community Care Center downtown, and how all three of those things work together. And then I'd also like to talk about pretrial. We're making a lot of progress there on some of our pretrial work to get better decisions to the judges and the prosecutors and the assigned counsel at an earlier point, but you can talk a little more about that. And then finally, I guess I'd just like to close by talking about what else we've got going on in terms of plans for diversion and reentry, because I know we're talking a lot about what we're doing to keep people out of the jail, but I'd like to know what we're doing to help them when they do get out to get back into society. Well, first of all, let's just start talking about the numbers that we were talking about in this program. How many do we estimate might be in our jails with mental illness problems or drug and alcohol issues that are probably the source of why they're in the jail in the first place? Do we have any idea of how many?
The latest information I have comes from the Corrections Bureau Chief, Todd Thoma. Mm-hmm. And I believe it's about a week ago he let us know that approximately 45% of the inmates in the county jail have principal Axis 1 mental health diagnoses. So they are diagnosably mentally ill.
Okay.
As far as substance abuse, I think, I don't know that we have accurate data on that, but from our experience in the field, John, perhaps you could confirm that, I would estimate that in the jail, upwards of 75% of the folks have some degree of substance abuse disorder or substance abuse as an issue.
That's certainly what I've been hearing over the last several years I've been dealing with this, but are you hearing?
I think those numbers are probably right. I'm very comfortable with the mental health numbers that, or mental illness numbers that Daryl talked about. And one thing that's alarming to me is the fact that about 4 or 5 years ago, that number was more like 20%. And so it's the increase that's really troublesome to me in showing the number of people that are going into jail that probably should be in some other kind of community-based service. The substance abuse numbers are hard to estimate because, frankly, we don't always know whether somebody is addicted or not when they're in criminal justice. But that's 75 to 80% in my 20-plus years of experience. I think that's pretty close.
And I'm assuming these are the same people that are recycling in and out of our jail, the ones that are the frequent flyers, as we call them?
Right. Many of them are. I think the big target issue here for all of criminal justice reform is trying to figure out what's driving this recidivism, the fact that people continue to circulate through the system, and addiction and mental illness, I think, my personal opinion is, are big drivers to that.
Okay. Well, what I think is so exciting about what's going on now, and this is the innovative justice we've all been working on for the past couple of years, I think we're on the verge of actually doing something about that and making some real changes. So I'd like to talk a little bit in detail. Could we start first with the triage? What's the purpose of the triage? And then go into some of the other programs that'll be complementary to the triage. Who wants to talk about the triage?
Okay. Well, maybe I'll make just a couple of comments, and then Daryl can certainly talk about it from a defense perspective. But, as I said, the numbers of mentally ill folks coming into the jail have substantially increased, and that's been a concern, I think, of all of ours for a number of years. Triage is designed to be a place for folks who are in mental health crisis and are contacted by law enforcement for whatever reason, a place to go other than the door of the jail. And triage is exactly that. It's a place where we can actually figure out what's going on with that person. Are they in crisis because they are mentally ill, or maybe they're just on some kind of a substance, or maybe they're both. To really figure that out, because then that helps us figure out what system do they belong in. Should they go into a mental health system? Maybe they need to be in criminal justice, but it gives us some time to figure that out.
Yeah. And what we do know is that they certainly don't need to be in the jail. And well, assuming there's a mental health issue, give this to you for your comment.
Sure, and I think my response is to address the portion where you talked about frequent flyers. And there's two ways of looking at people who are frequent users of the criminal justice system. One is that somehow they have a problem and they keep committing crimes. The other way of looking at it is that what we're doing to address the behavior is not having the impact that we want to have. So
That's kind of the way I've been looking at it, yeah.
At some point, innovative justice, and as we've been discussing it, is helping us to ideologically make a shift from what has demonstrated itself to be not effective at remedying those issues. And we're looking at possibilities to choose different alternatives because we already know that what we have been doing is not working.
Not working for us, not working for the people that deserve the service, better service than they're getting. And we know that the jails were never intended to be the mental health institutes of the state. They are, but that was not the plan. Okay, so aside from the triage, let's talk about, there are a couple other programs. LEAD, which is Law Enforcement Assisted Diversion, and then we have a Crisis Mobile Team, and then we have this new community care center going downtown. And I see all of these three things working kind of in tandem. Who would like to take a shot about talking about that? Daryl?
Well, I'll start by talking about LEAD. LEAD is a program that started in King County to address a problem that they had in the Belltown area. And the issue was that Belltown was gentrifying. Richer people were moving in, and they were experiencing open-air drug sale markets, people literally doing drug sales in the lobby of their buildings. And law enforcement and defense and the judiciary collaborated in King County, and they looked at the fact that what they were doing, the arrest and booking and prosecution cycle, wasn't addressing the problem. It was really just delaying the problem. And so they were open to looking at some other options that might work. And so they developed a program where essentially they moved the decision making from the prosecutor's office, from the judge, from the criminal process, all the way down to the street level, where law enforcement, with their more intimate knowledge of the neighborhoods, the communities, and the individual suspects, they were empowered to make decisions to give people an alternative from the traditional arrest and booking and subsequent prosecution. So essentially, to simplify the process, once somebody was arrested for one of those drug possession or drug delivery actions, they would be given the choice by the police officer in the field. Joe, we can either take you to jail and book you. You know how that works. We've done it before. But I'm seeing that you weigh less than you did last week. You look less healthy than you did last week. Maybe this is a time that you want to take advantage of some help. So the covenant that occurs between the police officer on the street and that defendant and the system of the law enforcement assisted diversion is that they offer that person the chance to go to a substance abuse evaluation where the focus is on giving information and seeking engagement from the person, because what we've learned is that people change when they're ready to change. And so it's a way of giving them that alternative. And I think when they started, they didn't know if it would have an impact. What they did know was that what they were doing wasn't working. So they were open to the possibility that this might have a better outcome. And what they found in 2 years of running the program with a very rigorous research analysis, and the University of Washington is researching their outcomes, and they're finding that it does work, and it works, where the old process had not worked before.
Well, let's hear a little bit about the Crisis Mobile Team. They're calling it CMT, is that correct? Crisis Mobile Team. John, can you fill us in about that? What's that all about?
So this is really a concept, and in fact, I'm of a mind that we might want to drop the word crisis from the name of this and just call it mobile outreach. But to me, this is kind of a LEAD-like program, but it's the next level. This is my personal kind of take on this. And there are some other communities that have tried this model very successfully. So the idea where lead, as Daryl described, allows an officer to, if they've arrested somebody, to take them someplace else other than the jail door and offer them an opportunity to be evaluated for treatment and so forth. With the mobile outreach unit, the professional is actually out on the street with law enforcement. So if law enforcement is out with somebody who could be in crisis or maybe is just clearly mentally ill or needs support, or is drug addicted and the officer is feeling like this person really needs to be in a treatment-based program as opposed to going to jail, they would have the ability to ask for the mobile outreach unit to come out, to make contact, and to potentially start that service right there, trying to get them connected to evaluation or whatever that might look like. This is very much a work in progress. So even now we're starting to design the protocol, if you will, for how this will work. But the concept is there that the professionals are out on the street and actually able to work with the person. So there's a direct handoff from the law enforcement officer to the professional. There's other possible things going on in the community that this may connect to as well. I think it's too early to tell, but the Providence group is looking at starting a community center where people can go for different types of services all co-located together. That's in development. I'm not sure we know exactly what that looks like either, but I think there's some real interesting possibilities in terms of how this LEAD program and the community outreach program, or I should say the crisis outreach or whatever mobile outreach, whatever we end up calling that, and the community center all work together.
But the idea, again, is just to find other options for more appropriate treatment than taking them to the jail.
Right. It's really about trying to make sure that that the people who end up going into the jail are the people that we feel really need to go into jail, the folks that are the most risk to the community, if you will. As you've sometimes put it, the people that we're afraid of, not mad at.
Yes, exactly. So I'm real excited about all this. I think it's going to come together pretty nicely. And I see the the mobile outreach team and the LEAD program working pretty close together. I mean, the law enforcement.
Yeah, to me, they're kind of one and the same in the sense that it takes that LEAD type model that is basically just offers law enforcement a diversion opportunity, but then takes it to the next level where that could actually happen out on the street as opposed to having the officer taking that person to a facility or a program or whatever. And
I understand you've added a little addition, added something too that might be a great assistance to those that are either in the LEAD program or in the crisis team. You offer the services, I think, 24 hours a day of one of your prosecutors so that they can consult if they need to know whether the person goes to triage or whatever. How does that work?
Right. Well, one of the things I was concerned about is with all these new things coming online, that if I had different deputy prosecutors all working on these cases, that they might not all be consistent in how they approached it. So my remedy for that is I've asked one of my deputy prosecutors to become essentially a point person for these types of programs, these diversion programs, so that it's one person that is helping to make decisions about which program people go into, has some specialized training and experience in that area, and then can really also help us to monitor how the programs are doing overall, and just I guess kind of have one person looking at it globally.
And I would assume that would give a little more confidence to the law enforcement officers as well, knowing that they've got the backing of the prosecutor's office when they make these decisions.
I hope so. That's part of the purpose. And also to have, again, you might have lots of different law enforcement officers approaching this differently, but if they're all, contacting one deputy prosecutor, that also will help us bring consistency to what they're doing as well.
Sounds pretty wonderful. I'm really excited. This seems to, as you were saying, this is really a work in progress, and I think we need to remember that the kinks are being worked out as we go, but I think we're getting very close. I just see things really coming together very nicely. Well, let's hear a little bit about pretrial. We've been making advances. Would you like to talk about pretrial services?
About a year and a half ago, John's office, my office, the Sheriff's Department, and others, we convened a group of subject matter experts, not at our policy-making level, but folks who really had experience of how things work in the field. And we asked them to come up with their best suggestions on how to refine all of the processes that occur between arrest and arraignment. And arraignment is the point at which the state makes its formal charges. It says, this is what you're accused of. People enter their plea of guilty or not guilty. And the court makes a decision about whether somebody can be released pre-trial or whether somebody needs to remain in custody pre-trial. That group came up with a number of different suggestions, and all of those suggestions were intended to give the prosecution, the court, and the defense the best information possible at that very critical stage in proceedings. Because one thing that we know from research from the Pretrial Justice Institute, is that when you're held in jail before your trial as opposed to released before your trial, remarkably enough, you end up convicted less frequently, you end up with less of a sentence, and if you do end up with a sentence, it ends up generally being a shorter sentence. So oddly enough, despite all of the lawyering that occurs, the one factor that seems to drive case outcomes, perhaps maybe even more than whether you have a good defense lawyer or a bad defense lawyer, is whether you were released pretrial or kept in custody pretrial. So all of their suggestions were leading towards giving us the best information possible so that the judge at that critical decision-making point can make a really good decision that's informed by validated data about whether somebody needs to be held in custody to protect the community, or whether they can be safely released either on their own recognizance, which basically means based on your promise to come back again, or whether there need to be some supervisory requirements or some conditions of release.
So it's not just that you have better information about the person, it's actually the fact that they're either released pretrial or held for trial purposes. That's which one makes the difference in the outcome? Is it whether you're released or not, or just how good the information is?
It's whether you're released or not, and we can be more accurate and be better. The court can be better with those decisions if they have a better quality of validated information at that point. Because in the absence of having a pretrial services team, which goes and interviews people in between that point of arrest and the time of arraignment, the information that we have to make that critical decision is minimal at best.
Right.
This actually applies manpower to go interview the folks, to validate where they live, to talk to community members or family members that may be willing to vouch for them and make sure they come back to court.
You know, and just to be fair for those in the criminal justice system, particularly judges and those, even prosecutors, those having to make these decisions, if you have good information, I think you'd be much more likely to let someone out, but I can't imagine a judge or even a prosecutor or anyone else involved letting someone out unless you really know. I know safety in the community is the utmost concern, especially to you, Mr. Prosecutor, to all of us really. But without information, I mean, you're not going to take too many chances, and I don't think the judges are either. Is that a fair statement to make?
I think that's very fair, and I think it's important for the public to understand that when somebody's arrested for a crime, oftentimes I think the public tends to conclude that this person is guilty because why else would they have been arrested for it? And the reality is, in the legal system, we're required to presume that that person is innocent until proven guilty. And I think people know about that standard in the law, but don't often consider it. But when a person is arrested and comes into our jail pre-trial, before they've been tried for the offense, from a legal perspective, we need to be presuming that they are innocent. But that being said, we also need to be assessing what is their risk to the community, and is there any risk that they will abscond if they are released, and to try to flee the jurisdiction or just not show up. Those are the only two factors, in fact, that a judge can consider in deciding whether somebody gets released or not. They don't really consider, is this person probably guilty or most likely guilty? All they're considering is, what is this person's risk to the community, and how likely are they to appear or not appear? And so the better information that we can have on those issues, the better decisions I think we all make, prosecutors, judges, and defense lawyers across the board.
Okay. I would certainly agree with that. And I've heard, but I don't know if it's accurate or not, that, we talk a lot about needing a risk assessment, a risk tool, so that judges and prosecutors and defense lawyers can make judgments about people. But I've also heard that good pretrial information can almost be as good or better than a risk tool.
And personally, I think that it can be just as persuasive to a judge. So, for instance, there are risk tools, and in fact, we're looking at different risk tools in this jurisdiction to try to help judges be more consistent in the decisions they make around risk. And there are a number of risk tools that have been studied and validated and so forth, and with lots of good statistical background and so forth. And I think that can be persuasive to judges, and they understand that. But at the end of the day, they also know that they are making a decision that impacts the community, and because of that, I think they would like to also consider some of the other more subjective things that are out there about this person. They would know a little bit more about them. Pre-trial, I think, would offer that. And so we would get that objective risk assessment, but then we'd also know some of the things that Daryl talked about, and that is, what are their connections to the community? Do they have a stable place to live? Are there other factors that might be driving their inability to come to court that we can deal with pre-trial? Is it as easy as maybe just making sure they get a phone call before court or whatever? Yeah. Bottom line is, I think that the more information that judges have, not just the statistical information, but just everything that you can find out about a person, is helpful.
Family support and everything you've got going for you in the community. Very good.
Right.
Do you have any examples between the two of you? I know you have to work sometimes adversarially, but sometimes you do work pretty closely together. And are there any examples you can think of that will kind of illustrate what we're talking about here, the difference of how people were treated or maybe are currently treated, and how they might be treated when some of these innovative justice programs are underway?
There are. In fact, Daryl and I have spent time sitting around the table talking about some of these cases that pop up from time to time with people who are really caught in the system, and the system itself, I think, or at least both of our offices feel like we're in a rock and a hard place. And it usually involves issues or when somebody is in the criminal justice system and probably should be in the mental health system.
There's a lot of that.
And there is. But once they're in the criminal justice system and without triage, right now, it's much more difficult to get them to move from one system to another. And so, for instance, we've had examples of somebody who might be technically committing a crime like a burglary. They walk into a house and through some kind of delusional behavior or something like that, and they're arrested for that, and they go to jail. But when they come up in front of the court, the defense lawyer who's talked to them says, "I'm not sure my client's competent to stand trial." And when that happens, and the judge says, "Well, we need to have an evaluation," everything in the criminal justice part of it stops. And so that person basically is just sitting there. And the fact that our mental health system doesn't react very quickly to that, and there's no resources for that, or I should say the resources have been substantially reduced. Unfortunately, that means they sit in jail much longer than they should, just waiting to be evaluated. And maybe what I'll do is hand the microphone over to Daryl, and he can talk a little bit more about this issue also from his perspective.
Not only is that sitting in jail a long time totally inappropriate for the person involved, but it's also, people should remember, costing us well over $100 a day for every one of those beds. I'm not sure, it's 114, it's expensive for the taxpayer. But again, more importantly is what it does to the client or the person.
So I can talk a little bit about what it does to the person, because prior to my life as a lawyer, I was a mental health professional and worked almost exclusively with chronically mentally ill people. And one of the things that we as a system are not equipped to do is to treat chronically mentally ill people. Nobody in the jail, short of medical contractors that they're trying to hire to help them with this issue, is trained in mental health or psychiatry or medicine. And one of the things that is most injurious to people who are in a psychotic or delusional state is literally to be locked in a cell for 23 hours a day. And that is the way that our jail is able to manage folks like that, both for their own protection, because they're particularly vulnerable in that condition. They can't be placed with other inmates that may potentially victimize them. But that's not the way any of us would want our family members treated if they were mentally ill. And as John said, some of those individuals come into our jail having committed minor or technical crimes. And then the tragedy is that as soon as one of the lawyers from my office sees them and hears some of the crazy things that they say, we are then ethically obligated to stop and say, Judge, this person needs to be evaluated because I'm not sure they can assist me in defending them. And then we have a mentally ill person in a facility that's not equipped to treat them, in particularly the kind of environment that actually significantly makes them worse. And we're not helping any part of the problem. It's not fair to the jail staff. It's not fair to the community members that are suffering mental illness that end up treated by the wrong system. And it's really not fair to the prosecution or to the defense because we don't know what to do with those folks either.
Yeah. Well, we're definitely on the right track. We've got a lot of work to do, but I think we're getting there. Another question, though, once we're working on everything to keep them out of the jail and to treat them more appropriately when they are entering the criminal justice system by arrest or whatever. But what are we doing when they get out of the jail? What are we doing about people reentering to society? Because I know that's going to be another big piece of making this all work.
That's a really good question, and I want to say that with our discussions around innovative justice, one thing I think we've done a good job of is looking at all of the different pieces of the system. And so the things we've talked about so far, the triage, lead, mobile outreach, all of those things are all focused on making sure that people who don't need to go into criminal justice get diverted out. But that being said, there will always be people that will go into criminal justice. The system will go through the system and into the jail and so forth. And so your question goes to the heart of the back end now. If they're coming out of jail, they've paid their penalty, they've served their time or whatever, and now how do we get them back into the community and give them a reasonable and fair opportunity to reintegrate, if you will. And again, this is all about looking at that idea of recidivism, trying to reduce the likelihood that somebody coming out of jail will end up going back to jail. In our history in Washington State, I think we've not done a very good job of looking at that issue at all. And it's probably one of the reasons why Washington is distinguished as having one of the highest property crime rates in the country, which is certainly disturbing for prosecutors. In our innovative justice discussions, I think we've come up with a vision based on a model that, for our purposes, came out of Oregon that they call community corrections. We're calling it coordinated reentry. The bottom line is there are a number of services that are out there and available for offenders coming out of jail, but it's really difficult to navigate them because you're going here for this one and here for this one and here for this one, and pretty soon it's just too difficult and people give up or they get caught up in back into their old lifestyle, whatever that might be. Our vision would be to try to bring all of these services together to co-locate them in some way so that there's one place where a offender coming out of jail can go to continue substance abuse treatment if they need to, or to get mental health services if they need to, or maybe just to get some job training, or maybe to seek their high school diploma if they want to do that. Whatever that is, one place where they can go, and that can be done in a coordinated fashion. Here's the rub. To do something like that, it takes an investment. And as certainly you know,
Yeah.
Commissioner, the county funds now are very thin, and so we're really looking for some funding opportunities, whatever that might be, trying to make ourselves as ready as possible so that when that opportunity comes up, we're ready to go. We know that there are grants opportunities out there from time to time that could help us with something like that. Perhaps the state of Washington one day might think about helping county governments to put a little plug in there.
They get
in
that help
way.
in Oregon, yeah.
In Oregon, that's the model.
Yeah.
But I think we've got a great vision. I'm optimistic about it. If we can just find the money to do that initial investment, the reality is I think we'll get a return on that investment probably over and over again long term as we see crime rates reduce.
Yeah, I don't think there's any doubt that we're going to see huge benefits
Right.
from all of this.
It's been the model in juvenile justice for the last probably
yeah.
20 years in this state, and we've substantially reduced our juvenile detention population, and frankly, the number of crimes committed by juveniles has substantially
yeah.
decreased.
Tremendously.
So I think we know that it works. It's just a matter of making that investment now in the adult system that we made in juvenile 15, 20 years ago.
And I think just getting onto the root problem of what got me in jail in the first place. Am I a drug addict? Am I hooked on alcohol? Do I have mental health issues? By addressing some of those things that got you there in the first place, it's going to be a huge step forward. And we haven't done that much in the past. Just whatever it is, when you do something wrong, you're in the jail. We don't really try to get to the root cause. And that's what I think is so beautiful about this whole initiative. So
I want to talk a little bit, add a little bit to what John was saying about reentry. When I first started practicing law and counseling defendants who were facing criminal charges, the tough and the difficult conversations, at least with misdemeanants, were about how do you get your affairs in order? How do you prepare to take your consequence of the 60 days or the 90-day sentence that you're going to be looking at? And even with felony clients, that really was the difficult conversation. Because of the advent of information technology, all of our criminal justice information is now readily available, and because of the operation of Public Records Acts, we have folks from out of state who are making money by gathering our criminal justice data and then selling it to employers. Criminal justice information is more readily available than ever before, and the one thing that we need to remember is that over the years, through our tough on crime policies and our budget shortages, we have made people who have done their time and paid their cost members of a class against which it is legal to discriminate. We ask it for employment. Have you ever been convicted of a crime? It may not be relevant at all to the type of employment, but we're still asking the question. Just an arrest, not even a conviction, can disqualify you from public housing with some public housing authorities. People returning from prison who have family members who live in public housing may not be permitted to go and live with family members because they are now felons. So we have all kinds of detriments and collateral consequences that attach to a conviction that do not end when the sentence ends and do not end when they have paid their last fine. And so some of the efforts that John's talking about with coordinated reentry, I think we're taking some steps to consciously ameliorate some of those difficulties and challenges that really have occurred off the radar because very few prosecutors' offices consider all of the collateral consequences to be part of the sentence that's imposed. And yet there are so many collateral consequences that they really should be considered, but none of them are considered by legislatures that determine what sentences should be. They always look at the crime, they always determine a sentence, and they never factor in all of the myriad of collateral consequences that make it difficult, if not impossible, for people returning from having paid their price for the mistake that they made or the crime that they did, to actually have them not be considered offenders anymore or returning offenders, but returning citizens, because that's what we want from them. We want them to come back to our communities, join our communities, strengthen our communities.
Well, before we're running out of time, but I would like one of you to say a little more about the impact on families. I know you've been very active in dealing with the ACEs issues, adverse childhood experiences. And I know, I've heard anyway, that once someone crosses the line over into the jail, there's all kinds of impacts to the family, like loss of job, families separated, families going off to relatives, foster care, whatever. Can you just list off a few of those things that happen to the family?
First of all, all of the clients that we serve in my office, we're the largest poverty law firm in the county. All of our clients are judicially determined to be indigent and unable to afford their own defense. Mm-hmm. So these are people who generally are underemployed or marginally employed. They hold minimum wage jobs, if they have jobs at all. Mm-hmm. And nobody can take 2-3 days off from work with a minimum wage job without the ability to call in and explain to their boss where they are without losing their job.
That's right.
So the same folks are trying to maintain families with this marginal income. It doesn't take many missed paychecks to lose your housing, and then these detriments all accrue to the family members. So as we're holding people in jail who perhaps we're not doing the best job of sorting the who we're afraid of from the who we're angry with, some of those folks are being damaged, and the damage is collateral. It goes to their families, and that in turn is a tax on our already failing social service system. So their families are now having increased needs for social services. Right. Statistically, a child whose parent has a period of incarceration is 7 times more likely to become a subject to the criminal justice system.
7 times more likely, okay.
And that again is another collateral consequence that we haven't considered. And these efforts that we're making, I think, also have the collateral consequence of trying to ameliorate some of these harms. But I think you also should hear from John. John has been working with a Professor Hellman, who is a specialist in hope. And and John has actually been touring the community as our local prosecutor espousing hope, which I think there's a little irony there. But I'll let John talk a little bit about
All right,
hope.
we're up hearing about hope. We've been hearing about negative. Let's hear about hope.
Right, and maybe I'll start by just piggybacking a little bit on what Daryl said in terms of the trauma that goes on with a family with somebody who ends up going to prison. There's a body of research called the Adverse Childhood Experiences study that really looked at the different types of trauma that children particularly face in life and how that impacts them later in life. And one of the sources of that trauma that has been studied is having a parent go to jail or prison, be incarcerated. And there's a couple of others. So a parent who is drug addicted or a substance abuser, having a parent who is mentally ill. The longer and more pervasive these issues are in the family, the more trauma that child is dealing with, and the more likely that child is then to have significant adverse outcomes later in life. They're more likely to go to jail themselves, as Daryl talked about. They're also more likely to have significant serious disease, to be mentally ill themselves, to be drug addicted or substance abusers themselves. So we know that there's this connection between that. I've started talking about hope in the community because it's kind of the positive side of that research, if you will. Hope basically meaning that we trying to work with people to help them determine goals and pathways to those goals in the future, and to really imagine what a future looks like for them. And the research tells us that if somebody has a strong relationship with the future, that is, they're thinking about the future, they have goals, and they're driven to achieve those goals, there's a number of positive outcomes for them that are just the opposite of ACEs. So they tend to be healthier, happier, and thrive and flourish. And the research around hope theory tells us that hope is actually one of the primary predictors and indicators of a person's ability to thrive and flourish. So for me, not just as a prosecutor, but just as a kind of a personal mission for myself, I'm really trying to carry that message of hope into the community so that we're really looking at all of our issues in this community, criminal justice across the board, from that framework.
Thank you very much. And actually, thank you to both of you. This has been a fascinating discussion, and I can't tell you how happy I am to see all this coming together. I thank both of you for your creativity and initiative in getting this going. what are we calling it? Innovative Justice?
Innovative Justice.
Innovative Justice. And the two of you have been absolutely key, and I can't thank you enough. This is really moving in the right direction, and I think by this time a year from now, we will be very pleased looking back and seeing how far we've come. Is there anything you'd like to add before we wrap up?
Only that
All of these things we're talking about are our own goals, and from that goals, I think we all have hope.
Very good. Very good ending. All right, last word for you.
So long as you continue to fund the pathway towards our goals.
Okay. All right, got the message. Okay. All right, thank you very much for watching. Again, I'm Cathy Wolfe, Thurston County Commissioner, and I want to thank our County Prosecutor, John Thunheim, and our County Public Defender, Director of the Office of Assigned Counsel. I have to call you Public Defender because that's clear.
that's what people understand.
Thank you very much for joining us today. Thank you again for watching this show. I hope you feel a little bit more enlightened now about some of the issues with our criminal justice system. And if we can all keep working at this, I think we'll all live in a much better world. Again, thank you. You're watching Thurston County Connection on TCTV, and I'm Thurston County Commissioner Cathy Wolfe.